हमारी TDR series में part 2 is lower eyelid surgery or blepharoplasty. So in the TDR, the Teach, Demystify and Reassure series, the first part is teaching. Now, lower blepharoplasty or lower eye lift surgery is done in specific situations where the patient says they have extra fat bags here, too much of extra skin hanging down, looking old, deep under eyes. These would be the indications for doing a lower eyelid surgery. Now, younger patients also can have this problem with large amount of fat bags, even though the skin may not be too much. And in these patients, we do the surgery from inside the eye in a surgery called transconjunctival blepharoplasty. In most patients, however, there is a lot of excess of skin and skin needs to be removed, as well as muscle tightening needs to be done in the conventional eyelid surgery. Now, there's not much of investigation. Diabetics, we need to take care of them. Other than that, most people can undergo this surgery very easily. The surgery can be done under local anesthesia or general anesthesia, not a problem, and it usually takes about 1 hour to 1 hour 15 minutes. I like to combine lower eyelid fat injection in almost every patient because the reason is most patients have this hollow here, and this hollow can best be covered with fat injection, and that is why I always like to do a lower eyelid fat injection along with lower eyelid blepharoplasty surgery. The surgery, like I said, takes about an hour 15 minutes. Patients can go back immediately. There's a lot of swelling for 7 to 10 days. Stitches are removed after 7 days. We don't recommend any exercising or sexual activity for at least 3 weeks. And swelling can be reduced by doing ice compressions for the first 3 days and then warm compressions after that. And patients can also start arnica gel and tablets to reduce further swelling. They can start the normal activity as soon as the next day, and overall it's a very comfortable procedure and extremely low rate of complications, and I'm going to talk about them in my next part. So in the part 2, the D or the Demystify series, these are the fat bags there in the lower eyelid. So 1, 2 and 3. The incision is given here just below the eyelashes. So the first doubt, that can the scar be visible? No. The scar is hidden in the crease lines and just below the lashes, so the scar is not visible. Then second, can it cause lid deformities like this? No. If properly done, along with the muscle tightening which is done in this direction, there is no change in the shape of the eyelid, and the eyelid looks absolutely normal. In fact, it looks much more rejuvenated. Third, this trough, which is called the tear trough, can this be improved? Absolutely. We inject fat all along here to improve the fat bags. And fourth, can removal of these fat bags cause any complication? No, absolutely not. If we are careful, we remove the fat bags properly, there is absolutely no complication related to this. So the fact about that there are myths about lower eyelid surgery which need to be taken away, and the procedure remains very straightforward and very simple. And so I hope I have succeeded in demystifying the problems of lower eyelid surgery. In part 3, the Reassure series of the lower eyelid TDR program, the point about reassuring is a patient has come to us with problems of fat and lower eyelid skin excess, and that patient will get a great solution because of the proper techniques that are followed. So the surgery is done from just outside. Fat removal, tightening of the muscle does not change the shape of the lid, in fact makes the lid more young. So the point about being reassured is, one, the complication rate is extremely low and even lower in doctors who are experienced, and it gives beautiful results, and your eyes start to look much younger and making your face look much younger overall.